This presentation on Ramadan, What Providers Need to Know About Ramadan, was presented on May 19, 2016, to the Somali Health Board in Seattle, Washington, by pharmacist Ahmed Ali. Dr. Ali talked briefly about Islam and the religious observances of Islam, of which fasting is the fourth pillar, and a few details about what Ramadan is and how the dates are dependent upon the moon sighting. This audio discussion picks up as he is talking about why Muslims fast.
Bodies, individuals are required, and there are a lot of exceptions to which I will talk about. There's a spiritual objectives behind this, understanding the plight of the less privileged, and appreciate what one has. So you've got, your fridge full of food. You've got, anything you want to buy from Safeway and so on. But then you have to restrict yourself in order to understand what the poor person feels like who doesn't have food. It increases charitable giving because you're required at the end of Ramadan that all Muslims have to give a certain percentage of their wealth. A certain percentage of their wealth. It aids in increasing the faith of the individual. And these are the reasons why folks that you'll be seeing in the clinics, people that your colleagues will be understanding. Why do they go through 15, 16, 18 hours of summertime? Why do they have to stay hungry when they've got food at home? Aids in purifications of their heart from the religious etiquette, and also includes, it's a requirement, sort of like, you prepare yourself for this month in order to how you should be acting the next 11 months. You have to be good in the next 11 months. So it's kind of like preparing yourself to be good. That's pretty much it. Exert control of the mind. You're going to be hungry, so you have to exercise your mind. So who fasts? All adults are required to fast during the month of Ramadan, 18 and older, or at an age where you are considered to be adult, with several exceptions. And you'll see the asterisk that I put in there. So children and healthy adults, folks who have chronic diseases and so on, even though some of them do choose to fast during the month of Ramadan, adults who are traveling long distances, so that you're not burdened while you're hungry throughout the process. Pregnant women and breastfeeding, women who are menstruating, and elderly. Most of the elderly folks do choose to fast, but they're exempt from fasting. At a certain age, when you're frail and your body can't take it, you are not obligated to fast. But you will have some patients who will tell you, yeah, I am diabetic, but yeah, I'm going to be fasting. So how do we as providers make sure that we adequately, make sure that we address those issues? That could help us.
And while 18 is considered an adult, in Islam you have to be of puberty. So they could be 12 or 11 when fasting is a requirement for them.
Thank you. So on a typical day, from sunrise to sunset, June, that's the summer hours. So that is about at least 16, 17 hours. Right? The intent initially is to make sure the Muslim individual has intent to fast, that they, you just don't wake up and say, I'm going to be fasting, but you should have the intent to fast. And there is one meal, 3 a.m., where you can eat, right? So you get to wake up early in the morning and go and eat. And during the fasting time, there are religious obligations people do, including prayers, refraining from, of course, drinking and eating and all that stuff that I just mentioned, and also from foul language, from bad behavior and so on, including smoking and so on. And 17 hours of fasting, a person, especially from a medical standpoint, experiences thirst, dehydration, decrease in alertness, may feel sleepy because, of course, your body is deprived of nutrition. Some folks do feel dizzy and so on. Still do show up to work. As far as I know, 99% of the people still go to work. They don't call in that month off. They don't take extended vacations.
You can sleep in your boss's office, though.
There's what
good luck.
Don't know why.
Good luck on that one.
I've been strongly in there before.
And during the process, there's also Quranic recitations where after they finish their fasting during the daytime, they go to the mosque from when they break their fast, they go to the mosque from 9 o'clock until 11 p.m. and they're actually reciting Quran, they're doing religious activities, and then the process is again. They perform what's called Qiyam prayers, and like sort of like a communal, all families and friends and everybody is together, and they're all after they eat and they pray. Breaking fast this is in the evening, so usually it's a family gathering. Obviously, some people choose to eat by themselves, or maybe if they're at work, that's when they break their lunch, their fast. Meant to bring some dates today to kind of drive the point, because once you have been fasting for 16 hours, you have a date to kind of, it energizes you. But we have camel milk for all those who are interested. So dates, drinks, samosas, those are, the triangular shaped desserts and things like that. That is sort of light foods what people usually start off with, and, then they eat. And, the idea behind why I'm kind of putting on that is to make sure that we talk to our patients not to overindulge themselves, when, they're about to break the fast. Of course you're hungry, you just want to eat the whole table, whatever is there, but, you want to make sure that...
You forgot coffee, the most important thing.
You're right, yeah. So, coffee is important for those who do, if they cannot function without coffee. Well, we go to work. The nurses, so the potential health concerns, of course, the physiological changes during Ramadan, I just mentioned, dehydration. It's important that we talk to the patients to make sure that during the time when they're breaking the fast, or in the morning when they're eating what's called the suhoor, morning meal, to drink water, plenty of water. Of course, heartburns, headaches. How do we address those issues while, either a month or two before, or probably now? For diabetic patients, I would highly encourage, providers do encourage the patients to check their blood sugar levels several times a day. Because you have all these patients who are going to say, you know what, my religion is more important to me. God is the one who gave me this disease, and I'm going to make sure that, I take care of what I'm obligated to do. Considering that some of them are specifically exempted from fasting, but they will still continue to go ahead and do it. Same thing with blood pressure. For some patients, low-income patients, they might not have that access to a blood pressure machine. Something as simple as that, probably given that. And also avoiding feasting in deep-fried foods, tasty stuff that you eat in the evening, meals and so on. So, we talked about, the first meal, which is, once you break your fast. There is a second lighter meal during the dawn, suhoor. So you've got about 7 hours. If you look at from where we are geographically, upon which a Muslim person eats food or can actually eat, that's between 9 p.m. and 4 a.m. And for the patients who are taking medications, I often usually encourage, you look at those patients, say, okay, what kind of medications are they on? And how can I adjust the dosage for this month? So single dose, once daily dosage, you can take it after you breakfast or in the morning before you have your food. So twice daily dosing, you'll be, common sense. When you wake up, before you eat, and after you break your fast, so on. But then you run into that issue of 3 times a day, 4 times a day dosing. Then you have to consider what are the options. Can I include a long-acting regimen into that? That probably will sustain this patient throughout their therapy in this month. And then the thyroid replacement. I take this as an example because we've got a lot of patients who we always counsel and tell them, you will be taking this medication first thing in the morning on an empty stomach, your thyroid medication, but then that's not when they're going to be taking this time of month. So when do you tell them that? It's sort of like, okay, you can take it for this month, half an hour before you break your fast, you can go ahead and take it, right? Or doing bulk, right? Before you start eating other foods. Because usually they will either break their fast with a glass of water, if not coffee, or dates, right? So take your medication around that time. So basically you got to adjust their medication throughout that month. And generally, rule of thumb for those patients, kind of see if you can meet with them the month before. Right now it's about 3 weeks, so less than a month, of course. See if you can order blood work. See if you can examine their glycemic levels, the blood pressure, check the lipids and so on, because they might not be coming to you. If you made appointments for them in this month, because some folks are very strict in terms of a lot of other things that they will tell you. Oh, well, if I'm going to get blood drawn, it's going to break my fast, so I'm not going to be there that month. Right? I'm not going to show up. So it'll be appropriate if you do these kind of things right now. And then I encourage smoking cessation is the best time to tell those patients. You've been telling, you've been talking to them about smoking. This is the best time. Hey, listen, you're not going to be doing for 4 weeks. Let's keep it up that way. You're able to do without 3 weeks, then maybe you've got a good time to go ahead and also encourage a healthy diet and during the month of Ramadan and a lot of hydration as well.
And you can tell them getting blood work done is not going to break their fast. And if they don't believe you, they can talk to the imam.
Right. Yep. And then, of course, you do have people who are going to, regardless of what you tell them, they're going to tell you, no, this is not what I was told. So, and who's the imam they follow. So reaching out during the month of Ramadan, overall as a Muslim individual, there are some of the colleagues who may not shake hands with the opposite sex, might not get adequate sleep, so may be taking naps at the office's boss.
Okay. You have a cool boss like I do.
In the wellness rooms, right. Prevalence, some of them may fast while sick, as I mentioned earlier. In this case, of course, if you feel that the patient is harming themselves to that extent, you can seek professional help. There are the mosques, there are religious folks that you can get in touch with in terms of that. And then, you have a colleague who was talkative. They always be fun and talking around. But then this month they are really quiet. There's a reason they're hungry. So you just gotta be understanding from that sense.
They have no reserve to talk.
So what happens after Ramadan? We celebrate, right? It is it's fun times. Folks have families get together. Lots of people exchange gifts. We go out. Lots of food, family gatherings, and so on. And the good thing is, instead of Washington, thanks to our legislatures and our governor, that it is recognized as a state holiday, so folks can actually take off a day from work. So thank you so much. So basically, in a nutshell, the next one, in the month of Ramadan, no food, no drinks, no smoking, no fun. Gotta be careful about your medication and your food as well. So, any
this
questions?
is all while you're fasting.
This is only during the fasting hours. Right. Any questions?
So if you have somebody who, for example, is diabetic and chooses to fast, and they're taking their blood sugar during the day, and they find that they really need something, is there a way that's kind of approved, or would they just ignore it? Or how can you, it could be a problem.
Yeah, that's a very good question. Technically, for someone who is on chronic disease management, such as diabetes, those folks are exempted. They're exempted from fasting.
Okay.
But when folks choose to fast, that is, they're making those decisions on their own, right? So if you have a patient that calls and says, hey, my blood sugar is really low, and I haven't taken my diabetic medication.
Okay.
Well, you can tell them, go ahead and take your medication, because there are ways that, especially when I mentioned about, pregnant women and folks who are exempt from fasting, those restrictions are sort of lifted in such a way that it's put in somewhere else where they can actually feed a poor person for the X number of days which they're not fasting. Right? So from a religious context, and they're religious, correct me if I'm wrong. So from religious context, that they are exempt from fasting. Right? They can actually break their fast. They can actually take their medication from that end. Right? But at the same time, they can also decide, okay, well, I'm not going to fast this number of days, and I'm going to have to pay what's called fidya. And make sure that those number of days that they're feeding someone who's poor, who's fasting during those X number of days.
Is that might be an option you can discuss?
Well, it's an option that you can discuss. You can just tell them, hey, discuss this with your imam at the mosque, and this is an information that I have, and if you have any other further questions, you can discuss that with the imam. And most likely they will tell them the same thing, because I ask the same questions.
Because it's not an obligation once they have a chronic illness that they're exempt from fasting. But someone who's been doing it for 20 years, 30 years, or feels so connected to it, it's really hard to break that habit. But if they're endangering their health, you can reach out and say, hey, you can talk to your leader and you can be exempt from it, or you are exempt from it, but we can give you...
So is it possible if it goes too low that you give them glucagon at home, they're not eating, they can just give themselves the shot?
Well, that was the question I had, is like, can you substitute something else?
Yeah, like
that
a
was,
shot rather than eating.
right?
Well, I would say yes, because would that break their fast is the question. I mean, that's not a question that...
Insulin doesn't break their fast, and the shot will does not. And that's from, I've struggled, I don't know about heat. It's okay to get insulin and the other thing from shot. As long as,
Salman, what do you think? Since you have more experience.
My question, I think what I've been doing with my patients is I tell them to do we would bring patients, like I'm making appointments for them before Ramadan. And so it's a discussion, collaboration between them and the provider. And we try and we adjust the medications. Let's say they're on insulin, 35 minutes, and cut the insulin in half. And to do a 3-down meal with insulin and after we get the fast. And if it's so low, we can check in between and monitor. And if they feel it's too low and they break their fast, they will not feel like they didn't try. So then I think that's what I've been using lately, and people like the idea. We'll see when Ramadan starts.
Right.
Have you had any instances where you had a patient use glucagon?
They usually do pretty good, and if it's dangerous to their health, they really break their fast. My experience was the patients that I coach for diabetics, the same thing happened, like our sister just said. If it's so dangerous and if their sugar is so low, they are not very complicated to, break their fast. Their health comes first, and they understand.
Like they are sick at that time. And I've seen with the type 1, they definitely say they're not going to fast.
Type 1 diabetes, yeah. And the idea is just to make sure that we educate them enough to make sure that they know that we don't want their sugar to go so low to be as a dose. So to that point.
And the appointment before Ramadan, it's really, really important, because I have a lot of patients who they try the providers to schedule appointments like in mid-Ramadan, and I advise them they will not be showing up. So can we get them 2 days before Ramadan? And that's what we have been doing, to bring them in 2 days, 1 day, or 3 days before Ramadan, instead of asking them 10 days within the Ramadan to come. That appointment most likely will not happen. So I suggest to do that, before pre-Ramadan checkup, and adjust the medication like Ahmed was saying, and work with them, because expect that this is going to be a big change for your patients.
Very good point.
I've had some mostly postpartum women who've decided they're breastfeeding, they're not going to fast, but they say that they will make it up later. Can you explain how that works?
Yes. So you can either... So when it comes to pregnancy, there's 2 school of thoughts, right? And it's from my understanding is, if the woman feels like that fasting is harmful to herself versus it's harmful to the fetus, there are 2 different thought processes to how you repay back. Because if me or Mohammed then decide that we're not going to fast either because we're sick or something, then we have to pay back. But for a pregnant woman, they have the option of either feeding a sick person during that time of the month, which they decided they're not going to be fasting, Or if they felt that it's because of harmful to themselves that during the pregnancy period, then they're exempted from fasting, which they don't have to make up. Right?
No, correct.
Correct me if I'm wrong.
Regardless, you have to pay back. Regardless.
There
You
are
will make it
different
up. You will.
after Ramadan comes. But, well,
That's a good one. I wish it was like that.
there is a school of thought though, where you
I
would have
probably
to
would
pay.
get pregnant, so I don't have to.
Hold on. And if you feel like the fasting is harmful to the baby, then you have to fast. If you feel like you yourself as a person, you can fast and you're okay, but your baby, something is going to happen to it due to you fasting, you have to fast. That's one of the rules. But you yourself feeling like it's harmful to you or something is going to happen to you, then you don't fast. But the ruling besides that is because God has gifted you with this child and God will protect this kid. So if you're fasting for the sake of God, you'll be okay. But if it's you and your health, then you have to make it up and you have to pay back. You have to pay and also make it up. So.
Should I let the ladies answer that question?
If that's not clear, at the end of the day, it's up to the individual. If she chooses to fast, she can fast and she feels safe to do it. But she doesn't have to during the pregnancy or the nursing period. However, after that time period is up, she needs to
Make it up.
make it up.
Make it up.
For the other Ramadan.
Hopefully, she doesn't get pregnant again.
Yeah. Which happens.
Making up.
It's the truth, though. Come on.
I have a question.
Yeah, I was going to say, what's the experience like of making it up later when, like, people in your family or community aren't necessarily fasting with you? I imagine that could be an additional difficulty to go through that by yourself. And how does one decide when's a good time?
Winter.
Every winter.
Which is and the really cool thing is
Monday fastings, the people who fast every Monday and Thursday.
Oh yes, yeah, you're
So
right.
that would be easier. And Mondays.
Mondays and Thursdays. Oh, so it doesn't have to be a 30 consecutive days.
No, it's the number of days that you missed.
Oh,
Yeah.
so
If
it
you
could be
miss 5
30
days.
days over the course of the next year, but not a 30-day consecutive.
Right.
and then people optionally fast Mondays and Thursdays on a regular, and 3 days out of the month on a regular. So technically, you will always have somebody who's fasting somewhere if you want a partner to keep you in line, and so it's helpful. But it is harder to try to make up those days that you miss when it's not in Ramadan. I'm telling you, there's like a mercy or something. Because when it's Ramadan, you can get through 18 or 17 hours of dehydration, not eating, working, and looking like a complete zombie, and on a few hours of sleep. And then if you try to make it up after Ramadan is over, it's like
Harder.
so difficult.
It's
It's
the communal
how did I do it?
Right.
It's really hard. So.
So you don't report it. It's just like really entrenched in someone's faith. It's like I'm not going to Imam to say I've done 30 days.
Yeah, no.
Nobody knows if you're hiding in your
Well, exactly. Well, the Catholics, Fridays we don't not supposed to eat during Lent, but
Yeah, so it's between you and your creator. I mean, you get to decide, well, I did track those days, so I'm going to make those days up.
The younger kids will go to school, eat, come home, and say we fasted. So.
Who hasn't done that? Other young guys going big factory. Get it, that's like that.
You were kids, you did it every day. When I was kids, it's perfect. No, kids.
Salma, go ahead.
Yeah, so I think what has been helpful for my patients, and I think this can take this from here today, is I refer my patients to a dietitian before Ramadan starts, so that they can have a, like an example of the foods that they're going to break their fast with, like a sample. So they know that, okay, when they break their fast, the pre-down meal and both meals, what they're going to eat. And the other thing is also, that's a meal plan and exercise plan. Don't do any exercise between the time of fasting. No vigorous exercise because, that will make your blood sugars go low. But after you break your fast, 30 minutes, 20 minutes, that will help our patients, and that has been helpful.
Any other comments?